Good afternoon, everybody. Welcome to Friday's briefing. You'll recall on Wednesday that we announced that we'd have this three-stage exit from lockdown strategy. Well, we hope we're still on course for that, but I emphasise that in relation to Guernsey, we will only make the decision as to whether we open on the 18th next Tuesday. It's not a guarantee. We hope that's the case. It will depend on the information we have between now and then. It's looking optimistic, but I'm certainly not saying that it's a certainty. Now, what we did have yesterday at the Civil Contingency Authority meeting was a paper from SARC. Now, SARC has never had a COVID positive case, thankfully. It's a very small community. It's behaved very well, just as people in Alderney and Guernsey have, I hasten to add. And we're pleased to be able to say that SARC will begin recovery stage 1 on Monday, the 15th of February. So that means that they will be able to open their economy a bit more at that time. It also means they'll be able to open their school, because their school is, the school numbers overall are very small, as you know, and the individual class sizes are very small. So SARC will resume, take another step towards normal living on the 15th. People will also recall that both in SARC and Alderney, they have very severe restrictions. Anybody travelling into those islands from wherever has 14 days self-isolation, come what may. Now, Dr. Brink will update us on the latest case numbers shortly. And although we remain optimistic, we still have bridges to cross before we can say press the button for stage 1 on Thursday. We have identified, as I think is aware, more cases in our home care sector. And whilst for the moment those do not give us any significant concern, it is an area that we have to monitor. And again, Dr. Brink will explain more when she speaks to you. Now, we've also reviewed our vaccine delivery policy. That means when you have your vaccines in relation to the second vaccine. And that was reviewed. The decision was actually made yesterday by the Health and Social Care Department. And Deputy Broad will explain more about that, because there is this point about the efficacy of the second vaccine if you have it at a delayed time. So that decision was endorsed unanimously by the Civil Contingency Authority yesterday. So again, I'll leave Deputy Broad to give more detail about that. Now, Deputy Salisbury and Chief Executive Paul Whitfield will address some of the questions we've received in the last couple of days, and there have been many of those, about when we've already had that sort of semi-move to stage 1, about support bubbles, lone workers, mandatory face mask, and those will come into force tomorrow. And I emphasise that you must wear a face mask from tomorrow in a public, enclosed public place. Otherwise, you're liable to a fixed penalty of £100, and that will be rigidly and strictly enforced. I'd also like to mention that from Monday, this coming Monday, we will be taking applications for a small business grant. We're reintroducing that. That was available last time round. These are for businesses which employ 20 people or less, or for self-employed people for whom business is their main income. The full details are available on the business support section of the COVID helpline, and from Monday you'll be able to make your application there too. Finally, I'd like to say that there was a full briefing late yesterday afternoon, to all our colleagues in Guernsey, all our political colleagues in Alderney and SARC, and it was very well attended. And it was very clear from the questions that were posed by members of those various jurisdictions that they well understand the problem, they're totally supportive, and equally they're totally diligent in making sure that civil liberties are upheld. We're grateful to them for their support. So we're encouraged against and through all our jurisdictions as to the support we're receiving, both from our political colleagues and generally. Anyway, enough from me, and over to Dr. Brink.
So thank you very much, Deputy Fairbrash. And I'm going to go on to slide 1, which is entitled COVID-19 Case Summary. And this, of course, gives you an overview of what's going on at the moment. So if you look, since the 22nd of January, we've had a total of 472 cases. And of those, 287 are still active. That means they've still got an ongoing infection. And 185 of these cases are now closed. Now, just to remind you, closed cases can either be those who've recovered or those who have sadly died. And of the 185 that are closed, I'm pleased to report that 185, all of them have recovered. So just under 40% of our cases that we've seen since the 22nd of January have now recovered. So that's encouraging. So if we go to the next slide, which is entitled Slide 2, COVID-19 Case Breakdown, I always like to give you some historical data of what's happened the week before to compare it with the data that we're seeing now. So if you look at Monday the 1st and Monday the 2nd of February, you can see on those days we had a large number of cases, 30 on the one day and 36 on the other day. But if you look at the breakdown of those cases, what caused me even more concern was that 7 were from an unknown community source on the 1st and 10 were from an unknown community source on the 2nd. So if we then move forward to Friday the 5th, you can see on that day we had 22 cases. But if you look at the breakdown there, 17 of those were due to contacts. And what we're seeing within the contact groups, and I'll show you this again later, is we're seeing large numbers of families being involved. So 3 or 4 cases can test positive on a day, but they're one family group. So that's important from our containment point of view. So if we then go on to the next slide, which is entitled Slide 3, COVID-19 Case Breakdown, and we move through the times and we come to the last 3 days. On the 8th, 9th, on the 9th, 10th and 11th, on all of those days, we've detected 1 care home staff positive on each of those days. Those cases were detected through contact tracing, and I'll talk a little bit more about that in a moment. But if we then focus on Thursday the 11th, so yesterday, we had a total of 12 cases yesterday. And of those 12 cases, 9 were contacts, but 5 of those 9 contacts came from one family group. So it gives you an idea again how we're closing the net around all these cases around the island. However, a word of caution, 1 was an unknown community source. So it was a symptomatic person who rightly phoned our helpline and came forward for testing, and they tested positive. We're still looking at any links, but at the moment, that case remains an unknown community source. So we need to keep vigilant. So if we then go on to Slide 4, entitled Care Homes, this gives you an update on the care home situation. And there are now 3 care homes involved. So in Care Home 1, an additional case was detected. So that's now 3 staff and 2 residents. Care Home 2 remains at 2 staff. And then we've had a 3rd care home where we detected a staff member who was positive. That's Cooldery. And with the care home, with the member of staff that was tested positive, it's important to note that this was detected through our contact tracing processes. So we had detected a case, and then we did some contact tracing, and as part of that contact tracing process, we identified this member of staff in the care home. So none of the residents in that care home have tested positive. So it just gives you an overview of the situation within the care homes. What is encouraging is that the vast majority of residents have received at least 1 dose of vaccine. Many have received 2 doses of vaccine. So we're not seeing the impact on the care homes that we saw in the first wave, but we still need to be vigilant in this sector, and that's really important. So if we go to the next slide, which is entitled Slide 5, which is our modelling slides, and again, just to walk you through these and remind you about these slides. So the green dotted lines are the individual cases. Now, as the numbers are relatively small, we use a 5-day moving model to smooth out the curve. And what you can see, that's illustrated in the blue line. If you take the grey dotted line, that was what would have happened if we'd done absolutely nothing on the 22nd of January. And you can see we were on an exponential increase. The amber dotted line shows that if we'd just brought in some social distancing, we would have an initial suppression of cases, and then we would have an increase after that. Now, if you look to the right of that, there's a plateauing of the numbers. Now, this, to a degree, relates to our active case finding. So we're moving from a reactive situation where we're looking mainly at symptomatic people and getting them tested and contact traced to a proactive case finding exercise. So we're increasing our surveillance programs. We're looking around areas of interest. We're also doing surge testing around areas that we know that there's been COVID diagnosed before. So that then means that we'll detect an increasing number of asymptomatic cases. And that's good because those asymptomatic cases can still transmit in the community and cause further infections. So that's really important as we move forward. So moving on to slide 6, which is again is entitled Modelling of Progression of Wave 2. It's a similar type of thing presented on a logarithmic graph showing doubling times. So as you can see at the start, we were going up to a doubling time of over 3 days, close on 2 days if we've done nothing. But what we're seeing with the impact of lockdown, we're seeing a flattening of that curve, and we're hoping to get it down even further. But we now have dipped down a doubling time of every 10 days. And so that really is an indication of the efficacy of the lockdown process. And my final slide today is actually by request, and forgive me, I can't remember your name, but you asked me to show you an illustration of the number of cases, number of contacts per case. And this is another way that we monitor the efficacy of lockdown. So if you look at the time of lockdown and the first cases, we're having over 25 contacts per case. What you see as lockdown progresses, and if you move on to about a week, 10 days, bearing in mind the incubation period of the virus is 2 to 14 days, you see a decrease in the number of contacts per case. And that is just illustrating the efficacy of lockdown, because as we lock down, you get fewer contacts between people, so cases have a lower chance of transmitting the infection, causing ongoing infection in our community. So I think that's another important way in which we illustrate the efficacy of lockdown. So thank you, Deputy Fairbrash. That's my update.
Thank you very much, Dr. Brink. That's very helpful indeed. Deputy Brouard will tell us, he'll give us a general report, but he'll concentrate on two things: the vaccine programme and also the timing of the second doses of the AstraZeneca vaccine. Deputy Brouard.
Well, thank you very much, Deputy Fairbrash. Good afternoon. We are still waiting for some of the returns to come in respect of the vaccine programme, but I'm pleased to report that more than 16,000 doses of the COVID vaccines have been administered across the bailiwick. 13,000 islanders have had their first dose, and of that 13,000, 3,000 have had their second. We estimate that nearly a quarter of adults aged 18 and over in the bailiwick have had at least one dose of the vaccine. This is an excellent achievement, and it's a real credit to the team involved who are ensuring that the programme runs as smoothly as possible. We continue to work our way through the priority groups identified by the JCVI, and currently we're vaccinating those over 70 years of age. By the end of March, fingers crossed, we anticipate we will have administered 27,000 doses of the vaccine. We had hoped to be in a position to release even more information about the number of people vaccinated and in each priority group. We are still working behind the scenes to provide more detailed stats, but the team is small and the work demands are large at the moment. The important thing I want to stress today is we are maximising each and every delivery of vaccine, and our wastage levels are exceptionally low. We have always said that we will be informed by the evidence in shaping our vaccination programme, and this continues to be the case. New scientific evidence has emerged in respect of how we can ensure that the vaccines administered are as effective as possible. Significantly, there is now clear evidence that by leaving a longer gap between doses of the AstraZeneca vaccine, the second dose is more effective, providing more protection to individuals. At the recommendation of Dr. Brink and her colleagues, the Committee for Health and Social Care has therefore agreed that locally, the second dose of the AstraZeneca vaccine should be scheduled for 10 weeks after the first dose, rather than the existing plan of 6 weeks. Put simply, by moving from a 6-week gap to a 10-week gap, we will improve individual islanders, or will give individual islanders greater protection. This does mean that some appointments which are already booked will need to be rescheduled, and Mr. Whitfield will provide more details on this. I appreciate that this may cause some inconvenience, but it really is the very best interest of those affected. As I've said before, vaccination is key to our response to this pandemic, and I encourage all those who are offered a vaccine in the early stages of the programme to accept their invitation. Please be reassured once again that the Community Vaccination Centre at Beausejour is a safe place for you to come for your vaccine. Its location was chosen specifically for our current circumstances, and our staff are waiting to welcome you there. Finally, in respect of the hospital, there are currently 7 individuals with COVID-19 in the hospital. We've just recently discharged 1. We have 2 receiving intensive care treatment in the Brock Ward high dependency area and 5 in Brock Ward itself. Including with this, 5 are the 2 COVID positive residents from La Grande Lande residential home, who I'm pleased to say remain well. Other residents from the home are being well cared for within the hospital, and all continue to test negative for COVID so far. So thank you very much, and back to Deputy Fairbrush.
Thanks very much, Deputy Breard. Deputy Salisbury will speak next, and she'll talk about some of the key announcements we made in the last briefing and reiterate and clarify some of the things that were said, especially where there have been lots of questions and other matters. Heidi.
Thank you, Peter. Now, we're very conscious that during the briefing on Wednesday, there was a huge amount of material that we had to talk you through. And I understand if it was difficult to take it all in. So I'm going to spend just a short amount of time emphasising a few of the key points. Firstly, the support bubbles we introduced from yesterday. This is probably the announcement that generated the most comments and questions, as lots of people just wanted to double check their understanding on whether they qualify for a support bubble or not. For me, I think it's a really good thing that people have contacted us and the helpline just to confirm their understanding, as it shows how we as a community want to follow the rules. However, it also tells me that it's worth us highlighting again what we mean by support bubbles and who they're for. We wanted to bring them in now, as whilst this is difficult for many of us, we recognise that some people within the community are more likely to be detrimentally affected by the social restrictions in place during lockdown than others. So that's why we decided that a number of groups can form a support bubble now, effectively a support network which links 2 households. Now, before I go through the groups that qualify to form a support bubble, it's important to clarify that only one household needs to meet the requirements to be eligible. If you qualify for a support bubble, you can bubble with any other household, but you must stay with that household when we move to stage 1. That's when the rest of the community gets to form a 2 household bubble too. So we just brought it in a little earlier, just for select groups who really need that additional support. Okay, so the following households are eligible to form a support bubble. Firstly, where there is only one adult, somebody just living by themselves, but this also includes households with one adult living alone or one adult and any children under the age of 18. Secondly, where there's only one adult carer, and this means households where there is one adult carer and anyone else living within the household has a disability and requires continuous care. Thirdly, where there's a child under 1, regardless of how many other adults are in the household. Fourthly, where there is a child under 5 with a disability that requires continuous care, and again that is regardless of how many other adults are in the household. And finally, where an individual needs to move in with another household to support their physical and mental well-being, so not just visit them, but move in with them. So we hope that's clear for everyone. But if you do have questions or really just want confirmation that you're doing the right thing, then you can, of course, contact the non-clinical helpline for that advice. And all the information is on covid19.gov.gg. Now, the other decision we announced on Wednesday that I just want to reinforce the messages around is the wearing of face coverings. Just a reminder, from tomorrow, it will be compulsory for anyone aged 12 or over to wear a face covering if they're in an indoor public space. Now, we've published extensive guidance on the COVID website about face coverings, which includes the details on what the indoor public spaces that this applies to and the range of reasons why someone might be exempt. We know there are those in our community who will fall into these categories, so please be kind and respectful of each other and don't immediately jump to conclusions if you see someone not wearing a face covering. Sunflower lanyards are being stocked in essential retail outlets for those who declare within those shops that they qualify by way of exemption. We know also that our third sector partners are distributing lanyards to people who need them. Yesterday, we published the printable exemption card that members of the community can carry if they prefer not to wear a lanyard. And again, this is on the COVID website, along with a separate version that can be shown on people's phones if that's how they want to display it. And both lanyards and the exemption cards are available from Bosa, Georgia in the opening hours of the vaccine centre for those who are already attending for their vaccination. Remember that from tomorrow, it will be possible for law enforcement officers to issue fixed penalty notices of £100 to anyone not wearing a face covering in an indoor public space, unless there's a good reason why they can't. We don't want anyone fined, though. This is purely to keep those around you safe, so please follow the rules. And one last point from me before I hand back, and that is, please remember that the wearing of face coverings in no way removes the need to observe social distancing or maintain good hand hygiene. This is an extra measure, not a replacement for what we're asking everyone to do. The fact we know this is a highly transmissible variant makes it even more significant. Over to Peter.
Thanks very much, Heidi. The last contributor on our panel, our Chief Executive, Paul, amongst his address, will deal with queries and questions about loan workers and matters such as those. Paul.
Thank you, Deputy Furbush. Following on from Deputy Salisbury's comments, it's worth spending just a minute or two re-emphasising the decision to allow loan workers to return to work if they truly meet the definition of working alone, i.e. they don't come into physical contact with anyone else, either colleagues or customers, whilst carrying out their activities. This also includes those that would normally work with a family member. Lone work is exactly that, individual lone working. The decision was taken because we want to support people to get back to work as quickly as possible, but it has to be safe. That is the key part and why it is, for now, such a strict policy on lone working. We remain in lockdown until we're able to safely move to stage 1 of our exit lockdown, as per the information we published on Wednesday. And we remain in lockdown because we are continuing to manage this active COVID outbreak. I would ask all businesses to keep that in mind when planning your operations. We have understandably seen and heard from lots of businesses who have tried to find workarounds to enable them to operate. Again, that is understandable, but I come back to one of our core objectives, which is to minimise the risk of virus transmission into our community. True lone working, where you do not come into contact with anyone else, is a very low risk activity, and we wanted to support those who are able to do so, and it's only a small tweak from the full lockdown. But if you're one of the people who cannot operate this way, please stick to the spirit of what we're trying to achieve and bear with us so that we can safely move as quickly as possible into stage 1, when you are likely to be able to operate far more easily. Speaking of stage 1, when we are able to implement those changes, as we said on Wednesday, there will be a requirement for businesses to notify the states of their intention to operate and to maintain records, demonstrating that they are working to clear method statements. This will be a web-based notification system. When businesses provide their details on the form, they will have to self-declare that they understand and will adhere to the public health regulations and guidelines that apply in stage 1. Once notification has been made, the business will be able to start operating under the new guidance straight away from the agreed date, which has been stated, we hope, if all goes well, but still to be confirmed, the 18th of February. Businesses will not need to wait for confirmation, and there won't be a backlog, as the form itself is the self-declaration of compliance. The Office of Environmental Health and Pollution Regulation will be coordinating these compliance checks. This system is similar to lockdown last year, but is more streamlined and efficient. Please note the form is not live on the website now, and it will be published shortly before we move into stage 1, when that decision has been confirmed. Now, on the decision around changes to the scheduling of the AstraZeneca vaccine, which Deputy Brouard has explained, we are putting that into action operationally. Anyone in the 70 to 79 age bracket who has been booked in for their vaccine will be written to. This letter will explain the decision and provide a new appointment date for your vaccine to align with the updated strategy. If anyone cannot make their new appointment time, they will be able to call and reschedule, and the details will be included in that letter. As a final point from me or from our colleagues in Employment and Social Security are today reminding islanders that if they've claimed income support or received hardship payments as a result of this lockdown, but are now able to return to work because of the changes for lone workers introduced yesterday, please contact the income support team to let them know that your circumstances have changed. You can contact income support by emailing incomesupport@gov.gg or by calling 732 508. Please do not visit Edward T. Whedon House as it's currently closed to members of the public. Thank you, and I'll hand back to Deputy Furbrush.
Thank you very much. The point's been made by all my colleagues that we're moving in the right direction, but we must continue to be vigilant. Otherwise, we'll move backwards. So it's up to every single member of our community to act sensibly, obey all the rules, and then we can move out of this lockdown as quickly as we can. But anyway, media, it's your chance to ask us questions. So who's got a question? Yes, Juliette Puto from the press.
Good afternoon, panel. You mentioned that next Tuesday you'll hopefully be meeting to decide whether we can move to the next stage.
Yep.
What sort of numbers are you looking to see in the next few days in terms of number of cases to hopefully mean that we can successfully move on?
There won't be a number in the sense that it's not going to be an arbitrary number of, say, 200 or 180 or whatever it may be. It's still going to be a large number, because even though the numbers have come down to 287, that's still a large number. But it's going forward that's more of the concern about the type of numbers we get in the next few days and whether they're unknown sources and whether those could be traced, etc. I don't know if you want to add anything, Dr. Brink.
So yes, thank you. So, for example, yesterday we had of our contacts, 5 of them, of course, were from a single family. So it really depends on the makeup of those cases. That's going to be of paramount importance. And so we're looking at cases or clusters of cases that we don't think that we'll be able to control by the track and trace situation. So what we're doing is we're focusing on those, and we'll be analysing it over the course of the weekend, and we'll be looking for those type of cases, so cases of concern for us, indicating that the current outbreak isn't controlled.
Thank you. Hamish, you've got a question.
Yes, Hamish from ITV Channel. A question for Dr. Brink. In one of the earlier briefings, I think I remember you saying that we would need between 7 and 14 days with no unexplained community cases before we could consider coming out of lockdown. I wonder whether you could give us an update on how that works with your thinking, just following on from the last point, really. Has the clock started yet, or because we're still having 1 or 2 community cases, has that clock remain where it is?
So the 7 to 14 days really is of more importance when you progress between stage 2 and stage 3, because you then are really opening up the community. Between stage 1 and stage 2, we're looking at whether there are cases, clusters of cases, individual cases that we aren't able to control. So if next week we were satisfied that we were in a situation that we could control individual cases, then there wouldn't be any reason why we couldn't move forward. But it all depends what happens over the next 3 days. It's going to be a really important weekend for us.
Thank you. Matthew Leach.
Matthew here from the Bailiwick Express. I'm going to start with a question from the public today. When can we expect osteopaths and physios to return to work?
It seems to me, well, no, I'll let Dr. Brink give, rather than me, give my opinion. She'll have a better view.
So emergency care is available, is coordinated through our medical director, Dr. Peter Raby. But if you look at individual services, it'll be more likely towards stage 3 or stage 2 and 3 that we'd be looking at those type of services. But each individual professional group will have specific risk assessments, and that will be coordinated through Dr. Raby. And I think it's important because a lot of these are face-to-face, hands-on consultations, and we need to be sure that it'll be safe to proceed with those. The important thing is that people who need urgent care, that can be coordinated through the current systems. Thank you.
Heidi?
Yeah, I don't know where the question came from, whether it was from osteopaths or not, but they will know when they are likely to be able to open, and they should be in dialogue with the medical director.
Okay. I'm only seeing the same three people. I don't know if anybody else has got the questions, but I'm only seeing the same three people. So I'll go through those people again. Juliet, your question.
Yes, I noticed that in America yesterday, they've put forward a changing of their advice in terms of people who've had 2 doses of the vaccine are able to obviously not undergo 14 days quarantine if they then have contact with a positive case. What is the panel's view on this advice? And is there any concern that this might cause some confusion among people locally?
Well, I mean, Dr. Brink will deal with that. But what people should look at is not what's happening in America or England necessarily. They look at what the rules are here. We've got our own set of rules, and those are the rules. So don't get them. People mustn't confuse themselves with what's happening in Botswana or the Czech Republic. Concentrate on what's happening in Guernsey. Dr. Brink.
Thank you. So the data on vaccine transmissibility, transmission after vaccination is not yet there. So the vaccination program protects against COVID morbidity and mortality. There is some data suggesting a reduction in transmission after you've had the vaccine, but from our perspective, we need to wait until that full data set is available before we produce any hard and fast rules.
Thank you. Hamish, what's your next question?
Yeah, this is a viewer-led question too, to do with pregnant women and the concerns they have, or some of them have. First of all, Deputy Albrouard had talked about encouraging people not to turn up at hospital if they had any symptoms of COVID-19. It felt as if that was suggesting that maybe had happened, and therefore some pregnant people are telling us they're concerned that they may be sharing an entrance, perhaps with people who could be COVID positive. And on the issue of the I know we've looked at this before, but the C-sections and birthing partners not being allowed in those surgeries, given case numbers are quite low, could those rules be relaxed? Is that a proportional rule still where we are now?
I don't know if you want to ask Dr. Brink.
No, thank you. No, thank you for that question. It is absolutely safe for mothers to come to the hospital to have their births. That's the first thing. We've got only one hospital, and we've got, if you do need a C-section, it's right in the middle of our hospital. So we're going to be absolutely rigid, unfortunately, on this. It's sad at the time, but we have to do it, and we're being very cautious to make sure that we don't get any infection in the centre core of our hospital where our theatres are. So unfortunately, we're not allowing other partners to come in if there is a C-section. It also means that we have to have more PPE. It also means we've got an extra person there that would have to look after that person. There's also issues where maybe have to do ventilation, etc. So from that point of view, I'm very sorry, but we are being fairly strict on this. But please, if anyone's got any concerns or they're coming to the hospital, let us know. And we've got midwives there who are happy to talk to people on the phone and talk them through what's going to happen and how they can be supported. So please be reassured. We're just making sure that the hospital is absolutely safe, because it's the only hospital we've got. And I'm not going to break any confidences here, but we have had instances in the hospital where people unfortunately have had symptoms and they've come to the hospital and it's caused us enormous problems. So I'm not going to say any more than that, but just to let you know that it has happened, and we're just making sure it doesn't happen again.
Thank you for that most comprehensive answer, Al. I don't need to go to Dr. Brink on that one. But I'm going to go. Sorry, Oscar, for some reason, Oscar Peterson, I can't see your hand, but I know you've got a question. So, Oscar.
Yeah, thanks for that. Hi, panel. Oscar here from BBC Guernsey. Thanks to Deputy Salisbury for her words of clarification on support bubbles. Can I ask for people who aren't very able, elderly and frail perhaps, would you remind us whether they're allowed to be visited by family members, children, for instance, to help out? I suppose it might come under the carer bracket.
Heidi.
Well, if they're at home and by themselves, yes, they can have the household join them. I mean, if they need care, especially at this time, I think they need to make sure that they contact health and social care if they need specific care on top of that. But otherwise, if they're by themselves, they can bubble up with another household.
Thank you. Island FM. I don't know who it is from Island FM. We'll find out in a moment. Who is it?
Hello, Peter. It's Jim Delbridge. Thanks,
nice
everyone. Just a quick question. I know we're in the middle of a cold snap at the moment, and I understand it is likely to continue. There was a bit of speculation about possibly having to change the location of the testing facilities. I wonder if there has been any impact on that, or whether there is any plans to change the locations. Thank you.
Paul Whitfield. Paul.
Yeah, good question, Jim. We've been watching the ongoing weather forecast very closely. As I think we've stated quite clearly, we're really pleased with the testing facility, particularly the non-clinical capability we've set up at the East Arbor Harm. We've now got over 1,400 tests booked into there, and it's running incredibly smoothly. We have looked at how we might use the ferry terminal and our secondary site at the airport. They all stand by, and we can step them up if we need to do so. But at the minute, thankfully, the weather looks like it's holding in terms of any reasonable snowfall.
Thank you. Matthew Leach, what's your next question?
I've got a question regarding schools. For what will a school day look like for students of essential workers going back after half term? Will it be mirroring the work set for students at home, or will it be proper lessons? I mean, what's to be expected?
I think in relation to that, they're already essential workers, etc., are already at school. They've been at school now for a period of time because the school's opened again for those and for others who needed that assistance. So it's more for the education department than us. We rely very much on their guidance, and we're in discussions with the education department. And in fact, Deputy Dudley Owen will be attending our next CCA meeting, which is on Tuesday, which will give us further advice. So I anticipate it'll be the same as it is now. We've got a very good distance learning programme anyway, generally, but of course that's for children who are not at school. But as I say, that'll be kept under review. I'll come to you again, Oscar, as I missed you out first time. I'll come to you again.
All right, thanks very much. Interesting to hear about SARC's measures coming before the rest of the bailiwick, and you mentioned schooling resuming there. Could you tell us if all the children who tested positive for COVID as you went through Guernsey schools have now recovered? Thanks.
Dr. Brink.
So they're amongst the children, amongst the numbers that have recovered. Obviously, some of them have been diagnosed later, but actually, in general, the children have recovered really well. They've had very few symptoms, so we've been encouraged by that. Of course, those that have then family members have become infected, so parents and so on, and have had more symptoms. That's to be expected. That's how COVID works. But most of the children have recovered and recovered well, but there are still some that are in the process.
Thank you. Hamish, your question, please.
Hi, thanks. Yes, another question from a viewer, and I'll just read it to you just because it's a bit specific. She's asking what the States of Guernsey's commercial tenants, what's happening with rents to do with the States of Guernsey's commercial tenants during this lockdown period. She says during the last lockdown, they announced that they would be setting an example to private landlords by deferring these commercial rents, but they've heard nothing in this lockdown.
I mean, that's a good question. The truthful answer is I can't answer it instantly as I sit here, but it will be, it is under consideration, and no doubt our able colleague Deputy Hellier will be giving consideration to that, together with Deputy Mahoney, who deals with property matters as well. But that is a good question. It's well asked. It's now in the public forum. Deputy Salisbury wants to intervene and say something.
Yeah, I think that's measures that we're going to be ratifying at P&R next week. It's something that's just come through to us, and I suspect Deputy Fairbrush probably hasn't had a chance to read the email that I've just seen on my side. But yes, that is something that is being considered, and I think something might be going out shortly on that.
Yeah, I did read it, but I think we're still going to endorse it. That's the point.
We do next, yes.
So watch this space. It's being addressed, but it's a good question. Juliet, your question, please.
Yes, I'd just like to say thank you very much to Dr. Brink for her evening updates on Facebook this week. They've been incredibly helpful. I think everyone's been finding them really interesting. I think in one of them you mentioned about possibly looking at surge testing people in areas of concern in relation to, because obviously we've had the community seeded cases, but I think you've said they've been linked to certain areas. I was hoping you might just clarify what you mean by areas. Are we thinking like shops, for example? And obviously how could surge testing then work?
So that's a really good question, and surge testing is something that we're using quite a lot at the moment. So yes, it's if we say identify a case in a shop, we'll test not around all of the employees in that shop, and perhaps even slightly broader than that. So if we identify a group in which we've seen cases, we'll then test broadly around that group. We've done that around some of the school cases that we've identified as well. So what you're doing with surge testing is you're taking a case and you're then trying to work outwards from that and see if there are any other cases that you can identify. You're particularly looking for the asymptomatic cases because you want to stop those chains of transmission. So you're continually looking to stop those chains of transmission. So our testing strategy really has three arms. It has the testing of symptomatic people, the surveillance testing where you're just going through groups of individuals looking for positives, and surge testing where you identify an area of interest and then you put some testing around that to see if there are any other cases you can identify. So those are the three arms of our testing strategy.
Thank you. Jim at Island FM.
Yes, panel, thank you. We've had a call from somebody from a supermarket. They're saying that from tomorrow, they will be on the front doors, as always, checking everybody coming in. But of course, with the mandatory wearing of face masks, there'll be an extra duty for them, just checking that everyone has them on. The question is, because it's possible to download and print off online a pass, in effect, which shows that you're eligible to not have to wear a mask, what advice can you give to the people at supermarkets to help them police people coming in through the doors? Thank you.
Thank you very much, Jim. Heidi.
Thanks, Peter. Well, I think really what we are working on trust, and we hope that everybody will abide by it. And yes, it might be difficult. I think the vast majority of people will be quite happy with this. What if people want to abuse the system? Well, they need to look at their conscience and think that they're not acting in the spirit of Guernsey Together.
And I think also added to that very good point that Heidi's made, we don't want the people at the supermarkets, that the security staff or whatever, to bother themselves. Clearly, they'll see if somebody's got a mask on, no problem. I think all they need to do is ask if they've got an exemption. If somebody says yes, they've got a piece of paper, produce it, but they don't want to get into any argument with them. It's the responsibility of law enforcement, and as Deputy Salisbury said, the responsibility of us all as citizens to make sure that we comply. So not seeking on the supermarket staff, that would be unfair. It's not for them to police it, but no doubt they'll exercise their common sense and good judgment. Oscar, your question.
Thanks, Deputy Fairbrushe. Final question from me today. Dr. Brink, based on slide 5 that you showed us this afternoon, you're modelling on the likely number of new cases, the moving average, depending on the measures we take. It predicts that we should now not be seeing any new cases or community seeding cases. We are still. I just wonder if you're able to expand on a point from Juliet earlier, whether you expect that to flatten out, as the graph describes, in the coming days to a level of no new cases. Thanks.
So if you look at how the 5-day moving model is calculated, is that it's calculated on the day of onset of symptoms, or if the person doesn't have symptoms, the day they were tested. Now, we know that not everyone has symptoms, and what we're doing now is surveillance testing. So we're going to detect more asymptomatic cases. So what I am expecting to see is a slight plateauing of the graph. That doesn't represent it doesn't represent symptomatic infections. It represents the fact that we're detecting asymptomatic infections by our surveillance testing. So I think, if I could predict over this weekend, I think we will continue to see a slight flattening, slight plateauing, hopefully with a slight decrease in numbers. But if we test, we're testing 1,600 odd people over the course of the next 3 days. A lot of those are asymptomatic, so we will detect further cases through that. So I think it's understanding the modelling and what we use it for is so important. And I think what I'm really interested in seeing is those unexplained community cases, where they are, and then what mitigations we can put around that to prevent the onward transmission.
Thank you very much. Matthew Leach, your question, please.
Question for Deputy Fairbrushe. Aurini's losses were predicted to be about £12 million this year, yet with it becoming clearer that travel will continue to be severely impacted in 2021, surely this projection will be much higher. What will happen if Aurigny maxes out its overdraft facility this year? And how has this second lockdown affected the airline's finances?
Well, that figure could well be reviewed, and sadly reviewed the wrong way. Aurigny are under the auspices of the State's Trading Supervisory Board, but ultimately it's the Treasury that picks up the bill, and they'll be expected to react to the situation as it is, and to ensure that, bearing in mind that we've got this lockdown, which was not expected, that they review their operational activities. Ultimately, the States is there to ensure that Aurigny continues, and the States will look at its finances carefully. Jim Delbridge. Jim, have you got another question? I see your hand's up. It might be.
Sorry, I left my hand up. No extra question at the moment. Sorry, apologies.
Sorry, that's okay. Hamish, you've got your hand up. Have you got a question, or is that an old hand?
It's very much a new hand. Just a quick question. I understand that over the last few weeks, the priority has been for you to be looking into how to deal with this outbreak. So I completely accept if you haven't discussed it. But are there discussions going on within the CCA about potentially tightening border restrictions in order to try and avoid another lockdown down the line, or will things like isolation policy perhaps get even stronger? Are those discussions taking place?
We've had them all the time. We'll continue to have them. I know what happened in Australia just today with an isolation hotel, but I don't mean that dismissively. It will continue. We may well tighten our borders. We may well have to bring in more restrictions. It's a very good question. It's not something that's going to go away even when we exit completely from this lockdown. Juliet, your question.
Yes. Earlier this week, Deputy Brouard gave us an update about possibly vaccinating people who are not ordinarily resident on the island but are currently living here, possibly older people. Yeah. How is that looking to be facilitated? And if you've got an older relative with you, when could they possibly expect to be vaccinated?
Thank you. Paul, you've got your hand up. Paul Whitfield.
Yes, just an update from the clear message Deputy Brouard gave that this was being looked at and indeed being supported. We are hoping to have up online, and we'll promote it, that by Monday coming, we will have a single point of contact for people to declare they are actually from another jurisdiction and they are in Guernsey. Now, we know that takes on different guises. Some will have NHS numbers, some will exact numbers of people we're talking about. So from Monday, nice, clean, simple point of contact that allow people to submit the details, and we'll work it forward from there, so we can begin the vaccination as necessary, dependent where people would actually fall in the categories.
Thank you. Matthew Leach, please, your question.
Thank you very much. In Guernsey, we have the CCA. In Jersey, a comparable deciding body would be STAC. Last year, the minutes of STAC meetings in Jersey were made public so we could better understand the decision processes there. Will CCA meeting minutes ever be publicly available as well?
Ever's a long time. Certainly they won't be immediately available. There are restrictions anyway as to what we can disclose under the law. But Deputy Salisbury.
Yeah, STAC isn't the equivalent of the CCA. Jersey have got a very different system. In fact, we've got a law that was already in place to enable us to undertake emergency regulations, which Jersey didn't have, and had to put something in with immediate effect when COVID came in. So it is different.
Thank you. Hamish, your question, please.
Thank you. A question for Dr. Brink. At the end of your presentation on slide 7, the data appears to show a slight uptick in the average number of contacts for cases. I wonder if you could tell us if that is statistically significant, if you like, or whether it is not worth noting.
I think she explained it, but she may want to add something.
No, it's not statistically significant. We're going to see a bit of wobble. They're low numbers. And so, no, it's not statistically significant. You're looking at a downward trend in the number of contacts per case.
Thank you. Juliet, your question, please.
We've seen some very rough weather this week. I know there's been some disruption to the freight boats. Has there been any disruption to the vaccine being brought into the island at all?
I think you can explain that where we are, Dr. Brink, can't you? Because February and March, anyway, I'll let you explain it. I know the answer, but you'll give it much better than me.
So yes, and we had to fly the one load of AstraZeneca into the island. So we're always looking at seeing how we can secure our delivery program.
Thank you. And Paul Whitfield, you want to ask?
Yeah, could I just add to Dr. Brink? I noticed in some of the community feedback on today's live broadcast, a couple of comments have said the rollout of the vaccine is very, very slow. I think you can see from the numbers mentioned today in today's panel session, actually we're doing exceedingly well. But I would emphasise the point that's been made over again by Dr. Brink and others on the panel, that we are distributing the vaccine against our supply chain. So when we get the vaccine, we provide the vaccine. We can't provide the vaccine when we haven't got it. But we've got a good supply line and we're keeping up with it. And the number of vaccines will increase, as just been indicated in March. But we're doing very well at the moment.
Yeah, and Deputy Broad made that point previously on several occasions. Point is, and so has Dr. Brink, as soon as the vaccine's in, there's a programme. There's not thousands and thousands of doses of vaccine just sitting in a warehouse somewhere. If we had more vaccine, we could vaccinate more people more quickly. So if those people on social media are saying that, we've told them the facts today, before, and we'll hopefully won't have to tell them again. Deputy Salisbury.
Yeah, I'd just like to add to that. We're getting our fair share as well. It's not as if others are benefiting when we're not. We are getting our fair share, and we're very thankful for it.
Thank you. Matthew Leach, you've got a question?
Carry on a vaccine question here. Are there any people booked in for a second dose of the AstraZeneca vaccine this weekend? And are they being contacted beyond just being sent a letter to make sure they know not to turn up for the scheduled appointment?
Dr. Brink, I imagine it's not going to be that reactive and that they will have to turn up this weekend, but you'll tell us.
So it's the rescheduling of the over 70s and over 75s. And I think the first people that are affected are the first week of March.
Thank you. Well, the only hand I still see up is yours, Matthew. So if you've got another question, presumably you'll ask it now.
I've got a final question here. Now, it's just to ask how public health staff are coping with what have been an incredibly busy 3 weeks of testing, vaccinating and other essential services.
I think I'm not going to adopt the words of my colleague, Deputy Liam McKenna, which said that Dr. Brink was an angel was sent down to earth. I'm not going to say that, but her and her staff have done a truly, truly magnificent job. But Dr. Brink, how is your staff coping?
I think that it's been long days. We've been working 16, sometimes 18-hour days. I think the support we've had from the community has been tremendous. So that overall wall of support that we have behind us. But I have to say I'm enormously privileged to work with the most exceptional team.
Thank you very much. Paul.
I think you'd expect me to say this, and I must acknowledge the public health team, but I must also acknowledge, as indeed Deputy Furbrush you did last week, that this effort is right across government and indeed other sectors that are supporting us. You can't forget that the retail are putting in incredibly hours and having to optimise their staffing levels because some were put into isolation, as we know. We have got people in business support teams, on switchboard teams, working incredibly long hours to support our efforts. It's a real Guernsey Together effort. And I just would want to commend everybody. They know who they are, that are working so hard for our community. Thank you.
Here, absolutely. In relation to that, I say that. And of course, Valentine's Day on Sunday, and one of the team that Paul Whitfield referred to as Mark DeGurry. I know how desperately upset he is that he hasn't been able to go and buy any flowers for his wife. And it's not true that he's got short arms and long pockets. We dispel that completely, Mark. But in relation to it, don't forget, Valentine's Day, and we apologise to the Forest. We know they've not been able to service the community in the normal way. We're very sorry about that, but we know they appreciate it. But bear in mind, love isn't just on the 14th, it's for the rest of the month, the rest of the year and forever. But I thought we'd finish questions, but I see Hamish has got his hand up. So, Hamish, what would you like to ask?
I do apologise. It's just a question on the Facebook stream. Some people asking about whether or not teenagers who live in care homes without disabilities can form support bubbles.
Deputy Salisbury.
I think, can we take this offline? And I think it's something that we will have to consider from a public health point of view in talking with Dr. Brink.
Okay, hopefully that answers it. Well, I think that's the last question. Thank you very much again, the media, for all their questions. Thank members of the panel for their excellent contributions. Have a good weekend, and let's hope we've got some good news for you next week, and enjoy the weekend. Thank you very much, everybody.